So will red light, LED masks in particular, red, infrared, near infrared, long infrared, will that harm your facial fat, your facial fat pads? This topic has been buzzing around and you asked me to talk about it. Today, we'll look at science and I'll explain exactly what it is you need to be worried about or not. Now, can this even help your facial fat pads? Because here's the thing, and not a lot of people talking about it, but you'll hear it talked about more in 2 years plus, is that healthy facial fat. And when it's not healthy, we call that dysregulation of facial fat pads. But when it's healthy and your fat is where it should be, you don't really need much of anything else because that is what keeps your face looking young. And of course, what does fat have in it? Well, it has mesenchymal stem cells, a very high amount. That's why we draw blood and get your stem cells and put it back. And it's why, or a large reason why facial fat transfer and BBLs and butt lifts work, because the fat dies off and leaves its stem cells. So it all plays a role, bone and fat, but let's dive into this today. If you're getting value from this video, like and subscribe. I give you a lot of information that's inexpensive to help you with your journey. And by subscribing, it helps me and you in turn grow. So first things first, LED masks and red near infrared light therapy have gained popularity for their proven benefits for the skin, including collagen production and anti-aging effects. But some have raised this question about the facial fat. This is because many home devices can harm your facial fat pads, including those with, you want to look for lasers and laser heat, RF radio frequency, which is a form of electrical energy, and some of the galvanics on the market, which also can produce heat and have an electrical charge. The other reason people are questioning this is that the intensity of the bulbs, the emission of heat, and the presence of red versus infrared and long infrared, mid-range infrared, they're all being questioned and many people don't understand exactly what it is. Remember, we're talking red and near infrared, which is in your LED face masks. So that you can compare what you are using or thinking about using to these wavelengths, we first need to understand what it is. Let's look at the science after that to guide us on an actual study looking at the fat pads. What I'm going to tell you in the next couple of paragraphs is going to clear up 90% of what you need to know. The next 10% will come from the study, and then I'll tell you my clinical experience, which to me is the most important of it all. But you need to know science, it's important. So keep in mind when you're talking LED masks, ones like mine, they're going to contain wavelengths like, if it says blue light, for instance, I'll give you my exact ones. Blue light, 415. If you're talking red light, mine's 630. And if you're talking about near infrared, mine is 830. You'll see some variations on this because there is a range of wavelengths within a specific category. Let's go through a little more detail so you understand. So you have visible light. When you talk about light that you can see with your eyes, that's 400 to 700 nanometers in wavelength. This is the light indeed that you can see with the human eye. It encompasses all of the colors of the rainbow. Think violet to red. Then you have ultraviolet or UV light. The wavelength range here is below 400 nanometers. You cannot see UV light. It's not visible to the human eye. What does it do? Well, UV light is known for its potential harm to living tissues. It's categorized as UVA, UVB, UVC, and of course, the good part of that is it helps your vitamin D. Now we have red light in particular. Here we're talking a wavelength of about 620 to 750 nanometers. Remember, mine was 630, right in that range. Can you see it? It's visible to the human eye. Red light has a lower energy and longer wavelength compared to violet or blue light. You can also see blue light. We talked about 415. Common applications of red light are used in the therapies. Here we go. Such as your red light therapy. It's used for skin health, and there's studies on wound healing. Now, here is when many of you get confused. Near infrared, NIR. Think of wavelengths 750 to 1400 nanometers. Remember my mask I told you is 830 nanometers. Near infrared, and this is a confusing part, it's further divided into this near infrared. There's also mid infrared and far infrared. So when we talk about your saunas, keep that in mind. Perception, can you see it? It's not visible to the human eye. These wavelengths are not visible to us, but to some animals, yes. Lucky for them, huh? Now, what are the effects of near-infrared light? Well, it's known for its ability to penetrate deeper into the tissues. That's why it's popular. So it's used in various medical and therapeutic applications as well as skincare. Think muscle recovery and pain relief. For the skin, it helps energize the cells and improve mitochondrial function, a key one. Also, collagen production. Near-infrared light stimulates fibroblasts. Those are the cells responsible for collagen production, increased collagen synthesis. Of course, that is the scaffolding that holds your face up and gives you that great glow, and it prevents sag. Number 2, wound healing. Near-infrared light has been found to enhance the healing process of wounds and studied to do so in injuries that were created. It promotes cellular repair and regeneration, which is of course beneficial to recovering that damaged skin. Number 3, pigmentation. I have a whole video on this. I'll link it at the end because hyperpigmentation is something everyone's concerned about with near-infrared light, but a lot of people believe things that aren't true about it. So there's a lot of misinformation out there. That's why I made a complete video, but it actually can help even out skin tone and reduce the appearance of dark spots in some studies. If you're using a source producing heat, here is where some of the confusion also exists. You do not want heat. That will have some risk for creating melasma, brown spots, and uneven skin tone. Here, you need to buy quality and know the wavelengths that you're getting. We use a temperature probe for every single mask of mine before it leaves the factory. We do not want heat production. In your sauna, yes, mid and far infrared, but not in your LED mask. Remember, your LED mask is near infrared. It also helps the near infrared with acne, like the blue light did, and also reducing inflammation, improve blood circulation, and you'll see it used for pain relief. Remember I said it goes deeper? Okay, now you know the wavelengths used in a high quality LED mask and that they are not the ones that are associated with the heat of your sauna. So the LED masks do not cause facial fat loss. But what about helping it? I want to show you this study because in my clinic, in my practice, I do everything to maintain the fat pads. Of course, you have things you do at home. I have whole videos, sunscreen, all the creams that you can use and topicals. But also in clinic, I use platelet-rich fiber and we draw your blood, get your growth factors, your exosomes, mesenchymal stem cells. That all helps rejuvenate your fat and your skin. Also, I use things like biostimulators, Sculptra, PDRN, polynucleotides, exosomes. Those are all things that help your facial fat pads. But LED light, I would never use it in my practice if it harmed facial fat pads. But here in this study, I'll show you exactly why I use it. And of course, I use it on myself. If I use something in my practice that didn't help facial fat pads, I'd be in big trouble in my clinic because none of my treatments would work. I need treatments that work with everything to make your fat pads better. Let's look at this and you'll see exactly why. Okay, let's look at this study, photobiomodulation with polychromatic light between 600 and 1200 nanometers. Now, this is going to help you a lot more. We went through what those wavelengths are. That's what they used here. Improves fat graft survival by increasing adipocyte, that's the fat cell, viability. Neovascularization, so that is the new vascular supply, and reducing inflammation. That's all the things we want to know. Let's look at this study, see if it helps us understand our face. Now, if we look here, I want you to read this. So important because so many of you are asking me about fat transfer to the face. The unpredictability with the final volume and viability of the graft are major concerns in fat grafting. It's why when people go get a facelift and they want volume, you need volume to look young, everyone will say to you, oh, I'll just do some fat grafting at the same time. Then they end up in my chair wanting more volume, and that's when we do plasma sculpt, PRF sculpt, or biostimulators, because just a facelift doesn't do it, especially delicate areas around the eye. So that's why people are studying this, in this case with photobiomodulation or these wavelengths. So they did an experimental study to see if they could increase the fat grafting retention, meaning let's say you put in 100% of fat, maybe only 60% of that lives, 40% dies. So if we could get 90% of that to live, or 100 at best, we'd be rocking it with fat transfer, but we're not there. So that's why they looked at this. What did they do? They took a total of 24 rats, divided into 4 groups, and they did light, different groups. So some of them got no light, of course, after the fat transfer. Some of them got light before they did the fat transfer and after. But look at this. In all groups, they took the inguinal fat pad was excised, so that's down in the groin area. They measured for volume and weight, and then transferred it to the dorsum. That means on the back. And of course, it's easier to look at volume and study it on the back. There's no fat where they put this. They had to take it from the groin region of the rat and then put it on the back. At the end, the fat grafts were harvested from the recipient site, and they checked the volume and the weight measurements to see how much took, depending on the ones that didn't get any light, the ones that got light before and after, to see, did it help the fat graft survival. You see, there's many theories on why fat grafting works. One of them is that you get all the fat dies and the stem cells stay and then the fat grows back. Another theory is that, and there's 3 main ones, but these are the 2 main ones. The second one is that you get, each fat cell, of course, has its own blood supply. So you need to have great blood supply for fat to live. And one of the thoughts is that each fat cell that you harvest and you put back in there gets blood supply, neovascularization, so that it gets new blood supply. And that's why we talked about neovascularization. But they wanted to measure to see, did the fat survive? That's the holy grail. For you and I, we want to maintain our fat pads. We never want to facelift. We never want to have fat transfer. We want to keep it healthy. So if we look here, intergroup comparison revealed that fat graft retention regarding weight and volume was significantly superior in group 4. Well, what's group 4? That had polychromatic light, so they were exposed to light both before and after transfer of the fat graft. Okay, so you see it also increased angiogenesis and neovascularization. For you and I, not wanting to get surgery or having had surgery, or maybe you have and you want to maintain it, this says a lot, because this is saying this will also help keep, we're extrapolating here, but we can extrapolate, if it helped grafted fat, why not help the fat that's already in your face? And the conclusion was, if you see down here, increased volume retention, increased neovascularization, adipocyte viability, so the fat cell is ability to live, and reduced necrosis, so the death of the fat cell. None of us want that. It reduced fibrosis and it reduced inflammation. All the things that light is supposed to do. And to me, this is fantastic news. I'd say this is why I and my patients and people using my mask are looking younger and younger every day and every week, along with their great skincare. Now, before we move on, remember, I have quizmd.com. You can go there and in under 2 or 3 minutes, answer a few questions specific to you and your skin, and you will get your skincare routine that's best suited for you, because what makes the biggest difference in your journey is going to be a great, consistent skincare routine that works for you. Whether you're using my products or not, you can look at the ingredients, match them up, and it will give you your answer for your best journey. Let's move on. Now let's talk mid and far infrared. You think about higher wavelength ranges like 1400 nanometers. These are not ones I use in an LED mask, and here's why. It's not visible to the human eye, but this mid and far infrared radiation, they are indeed associated with the generation of heat and are used in various applications for their warming properties. Think infrared saunas of course, everyone asks about and whether they will cause dark spots or brown spots. You see, this wavelength has the ability to penetrate the skin, the muscles, and the tissue deeper. The far infrared range covers wavelengths more like 3,000 to 1 million nanometers, so in the high end of the spectrum. Most people use these for things like night vision technology, remote sensing, communication. So far infrared is often associated with this heat and thermal imaging. So knowing this, now you know the wavelengths used in a high quality LED mask and that they are not the ones that are associated with the heat. Now this may bring up more questions, and certainly I'm happy to do more videos, but if you go to this playlist up here all about red light and LED masks, and one down here about natural ways to boost your own collagen at home, that's going to be very helpful for you to keep your skin and body beautiful, healthy, and vibrant. Stay tuned.